Welcome, everyone. This is our training for Advocacy Day. We're very excited to have you all here on May 1st in DC. And this is a training so that you're all prepared for the big day. So, next slide. So I just wanted to introduce you all to my team. This is the public policy team, and we'll all be there helping you as well as some other IDF staff members. But we have here today Stephanie Steele, the Director of Payer Relations and Policy. Stephanie's up on the screen as well. You know me, I'm Lynelle Biso. I'll be doing the presentation. Rebecca Russ is the Grassroots Advocacy Specialist. Hopefully, you've been interacting with her. She's going to be your main contact for logistics and everything else in terms of planning for Advocacy Day. I want to thank Becca for all the hard work that she's been doing to prepare for this event. Matt Prentice, he's our Director of State Policy, and hopefully you may have opportunities to get engaged with the state workshops and other state work that we do as well. And then we have Eric Fagan. He's our new Regulatory Affairs Manager. He does a lot of work on all the great agency stuff that's happening right now in DC. So he's really a big help to our team. And will be helping us as well on Advocacy Day. So next slide. So here's the agenda and housekeeping. We have, well, you'll see the memories from last year. We learned about PI and then you'll hear about the Advocacy Day asks and effective advocacy, and then logistics. So hold off anything. If you have questions about logistics, I know you're all chomping on the bit to find out every little detail, but we will be doing that at the end. So hold off your questions on that, and then we'll have specific Q&A. So make sure you ask the questions using the Q&A box on the bar across the bottom of your screen. At the end of the program, we'll answer as many questions as we can, and you can always email us afterwards for things that haven't been answered. Say hello in the chat box and let us know what state you're tuning in from. So, and these are some pictures from previous years. So very exciting to, we'll be down there again. Hopefully the weather will be nice and we'll have lots of opportunities to meet with different legislators. So here's some of these are also state workshops that we've done. Most of you know the mission of IDF, so just have that up on the screen. Basically just remember we represent and we our mission is to improve the diagnosis, treatment, and quality of life for people with primary immunodeficiencies. And this year we're going to be doing advocacy, and we're educating you now, and we're also going to be advocating for research, which is we rely so much on the funding for research from the NIH. Next. So we always kind of start with what is primary immunodeficiencies. I know all you guys know about PI, but it's really important that when you go into offices that you lay the groundwork by giving a quick primer on who we are, who is our community, and what is PI. And these are some bullet points, that what PI is. It's a group of more than 550 rare chronic conditions, which part of the body's immune system is missing or does not function correctly. I'm not going to go through everything because I think you guys all know that. Just want to highlight as well that we're using the number that is cited from the NIH, that there's approximately 500,000 individuals with PI in the United States. And as you know, every year thousands go undiagnosed. Next. So this is going to be the asks that we have this year. And as a lot of you know, there's a lot of different things that are you'll hear from Faegre, you'll hear about, what's happening at the federal level. But that was why it was so important to us to sort of prioritize these issues that are coming to the forefront right now with everything that's happening with the new administration. So some of the work that we've done in the past, particularly the SNF bill, the skilled nursing facility bill, we don't have as an ask, but we will keep that in the materials. And it's still something that we're trying to get through, but it's not one of our primary asks this year. So, the first one is protecting vaccines and protecting people using vaccines. We know that people with PI are highly susceptible to pathogens such as measles, whooping cough, COVID-19, RSV, and flu, and we're more likely to have severe outcomes in the general public. And because of our people with PI, uh, have antibody deficiencies. They're not able to mount the protective antibody responses to infections and the vaccines used to fight these infections. So that's why it's really important that we ensure that enough people in the community are vaccinated and protect those who are immune compromised. That's called community immunity or herd immunity. And that's why we are so pro-vaccine, because we really want to make sure that everyone around you, everybody in the community is adequately vaccinated. And the reason we're sort of bringing this up is we want to make sure that the leadership of HHS really embraces the longstanding science of immunization. And there's been concerns about that from some of the leadership, some of the messaging that has been coming out. We're very concerned about the fact that there's measles outbreaks in certain parts of the country. We're concerned about some programs that have been funded in the past to support vaccine development, as well as the communication around vaccines have been pulled back. So we want to make sure that we put out the message that that we really, the agency must support vaccination. And so that's what we'll be doing in terms of providing you information and providing the office's information about why that's a priority for us. Next. The second thing is something that a lot of groups are advocating for. So this is likely in your offices not going to be the first time that they've heard about these issues, safeguarding Medicaid coverage. So we want to make sure that everybody with PI, regardless of what kind of insurance they have good coverage. And right now, those who rely on Medicaid for a coverage are really at risk of cuts from the federal government. So we know that an estimated 1 in 5 people with PI rely on Medicaid, and this, cuts to Medicaid will hinder their access. And there's a few different ways that this can happen, and we want to make sure that we share with legislators why we're concerned. We're concerned about the working requirements because that threatens to take away coverage for a lot of people with PI who may be unable to work different times of the year. As if you get sick a lot, you might not be able to maintain a job. And, having work requirements could really be a hindrance to them being able to get the coverage that is so vital. Per capita caps is another issue for us. What that means is it kind of limits how much money is allocated for each person in a state. So when that happens, what's going to happen is similar to what happens often with private insurance is they're going to be much tighter and on managing access to IG therapy, which is so expensive. If you were going to pay out of pocket, it would really be unsustainable. So in that case, what happens? People end up not taking their medication. So we're against the per capita caps, and we're very concerned that that would impede access to IG therapy and other kinds of therapies. And then just in general, proposals to cut or limit federal funding. Um, there's a bunch of different ways that this can impact our community. In general, when you cut Medicaid is a shared responsibility between the states and the feds. So if the federal government cuts back on programs, then that they're funding through Medicaid, it's going to have to be picked up by the states, or the states are going to have to limit what people can get. So, by shifting the responsibility, it's still the needs are there. So, and there's been a lot of reliance on the states to be able to, within their budget, to be able to, cover the people who need their help for funding and for their health care. So we'll give you more detailed fact sheets on all of this, and which you'll be able to share with the legislators, as well as some more specific talking points. So if you have specific questions, you'll have that in your packet. I know it can be kind of wonky dealing with Medicaid and Medicare and all that. Next. So protecting research, that's another one. I mean, we really want to invest in research and make sure that, that research and development on innovative therapies continue. We know that it's incredible how much has happened in terms of improved treatments and innovation in PI treatment in recent years. And we wouldn't be able to do that without the federal funds, without NIH research. And, we're very concerned about cuts to NIH. So we have a fact sheet where we give some very specific examples of how the PI community has benefited from NIH research. So there's three examples that stand out, but there's many other examples where federal funding for research has supported our community. But the top three are NIH research on bone marrow transplants. That has led to treatments for several types of PI, like SCID, CGD, and Wiskott-Aldrich syndrome. It's also sort of laid the groundwork. The research on bone marrow transplant in PI has helped all kinds of treatments in other rare diseases that rely on bone marrow transplantation, because PI was one of the first to do that research. Second, NIH developed the newborn screening test for SCID. That's used in every state. That has, transformed SCID treatment in the past. Moms used to basically lose a child before they knew that they had a child with SCID. That was sort of their way of screening. Now we can, save children by knowing upfront that they have SCID, and get them the treatment that they need. And that's been really life-changing. And then the third is a more recent thing that recent development that has been approved, but it's been developed many years ago. It was NIH funding for grants, allowed for the new treatment for rhythomic, which is for congenital athymia, where a baby is born without a thymus, so they don't produce the T cells. So they have this treatment. Actually, they implant a piece of the thymus that's been treated into the baby's leg, and then they can actually have a reconstituted immune system. And that was developed at Duke University with federal funding from NIH. And we want to continue that kind of funding that goes to institutions. And then I just put down also that there's many patients, and many of you may know people or have experienced that yourself with your families, if you've participated in clinical trials or other kinds of treatment through the NIH, we want you to give your specific examples. If you have some experience with the benefits of federally funded research, then this is the time for you to share that. If you don't have specific examples, we have fact sheets that talk more detailed about the three that I just discussed, and we'll be sharing some talking points that you can use to help when you're in the offices. So next. Okay, so now we're going to go over to Faegre Drinker. That we utilize Faegre Drinker as our lobbying firm. They have been with us for a long time, and they're great at sort of navigating the system that we're in now and working with us to get our legislative priorities through. So do we have them on the?
We're here.
Oh, okay.
Yeah.
Is it Nick first or Nisha?
Nick.
I'll do a quick kickoff and then over to you.
Okay, great. All right, go ahead, Nick. Thank you.
Thanks, Lynn. And yeah, great to be here. Great to be back for Advocacy Day. It's been a while, that we've worked together with the foundation, and this is certainly an interesting time. So we're looking forward to tonight's discussion to give you a little bit of an overview of what you'll expect here in Washington, and then some discussion about how we can continue to be effective. IDF has been very fortunate to have achieved a number of policy wins over the years through your evidence-based approach to advocacy and by building strong bipartisan support on Capitol Hill. And so much of that comes down to all of you and the success of Advocacy Day. So I'm going to turn it over to my colleague, Nisha, who will guide us through the training session here. And we're looking forward to the discussion. Nisha?
Yeah, thank you, Nick. Next slide. And I know you can see both Nick and I on today's conversation, but we also have a third colleague, Megan Herber, former Hill staffer, who's also part of our team. She was actually at Representative Matsui's office. And as you probably know, those who are being engaged with IDF, Representative Matsui has been a champion for IVIG therapy and was really was actually a lead sponsor on the bill that ultimately made IVIG in-home access permanent. So this is our team in Washington, D.C. All three of us are here, and we'll see you, of course, on May 1st and the day before. Next slide. So welcome to all those. This is your first training, your first Hill Day. It's going to be a great experience, a lot of walking. I'm sure Becker will mention that at the end when you go through logistics, but surely get excited. It's a really fantastic day. But as you walk through Washington, D.C., you'll also be stepping into a city that has just been through the first 100 days into a new administration and Congress, where early decisions have surely begun and shaped a lot of the news cycle and policy. A lot has happened since January 20th, when President Trump took office, and a new Congress was sworn in on January 3rd. And so hopefully part of our conversation today and our presentation is give you a lay of the landscape of what's happening in Washington, D.C., talk about actually what your meeting's going to be like, and also provide you an opportunity to do mock meetings, meaning actually be able to practice what we're going to talk through. And hopefully our portion won't take too long, so you can actually go and meet each other and actually talk and see how these meetings go just individually. Next slide. So we are in Shirley 2025. The theme, I think, since January has been major overhaul, sweeping actions aimed at creating significant change quickly, a bit different than what we saw Trump 1.0, maybe, I think some would say break things, fix later approach, while others view it as necessary shakeup, making good on a lot of campaign promises. Since January 20th, we saw a fury of executive orders, and I listed some here that specifically are in the healthcare space. So first one on that some of you may have tracked, in February, NIH issued new guidance, which would establish a 15% indirect NIH cost rate. Indirect costs are expenses not directly tied to running a clinical trial or project, but rather are the expenses that are to the overhead. So think of recruitment staff for a clinical trial, the office space, the utilities, the resources. And so when that decision came out, there was a lot of concern across academia, as many feared it would impact the resources needed to support the infrastructure of ongoing and new projects. So that was one that came up in February. One that came a little bit more recently that definitely took the healthcare space by turn was an announcement on March 27th, so just a couple of weeks ago. Secretary Kennedy announced plans to lay off 10,000 HHS staff, so across FDA, NIH, CMS, CDC. And these cuts, in addition to the buyouts, in addition to the probationary cuts, would effectively result in a 25% reduction in the workforce. In that announcement was also another piece. So in addition to the layoffs was plans to create what is called the Administration for a Healthy America, AHA, which would actually also consolidate 5 agencies, including HRSA, one that maybe some of you are familiar with in the newborn screening world, into one. I think we're still trying to grapple what that AHA will look like, what functionalities of each of those independent agencies will be maintained and retained. But that was also part of that same announcement. Another one that's noted here is establishment of the MAHA Commission. That was in mid-February. That EO established the Make America Healthy Again Commission, chaired by HHS Secretary RFK Jr., Robert F. Kennedy Jr., to address a number of critical health issues that were noted quite a bit throughout the campaign trail. So that includes reform to food supply, prescription drug approval processes, immunization policies. And within that EO, there was a lot of emphasis specifically for the commission to focus on all these issues, but focusing for children's health in the primary, in the initial assessment. The last one on this one is push for affordable IVF treatment. This is certainly one of the hot topics during the election cycle, but we saw an EO that also reflected much that was said previously. In addition to the EOs, beyond the executive orders, the guidances, there has been a lot of effort to just frankly streamline federal government, shrink federal government, federal funding, with the aim not to shrink. I don't think that's necessarily the word that's used, but rather improve efficiencies, reduce with perceived redundancies, any waste in the federal government, and efforts to do so, not surprisingly, are going to impact the healthcare sector. The healthcare budget is a pretty substantial part of the federal budget, and so if you take any cut of that, there will be repercussions, and they're definitely going to be. Has always been scrutiny and a need for reform in the healthcare space, where we certainly see this administration interested in doing so. We've already seen a lot of grants and programs put on pause or being terminated. And so that's kind of all in that theme of bringing efficiency to the federal government. As we know, healthcare is not the only topic that is in the news cycle, and certainly not the only topic that this administration cares about. We do live in the universe of a whole host of other issues, trade policy when it comes to tariffs that were just announced last week, the stocks falling, immigration enforcement, foreign policy. So we give you this rundown more so to recognize when you come on May 1st, there's Washington, D.C., there's our issues that you're going to be coming with, which you're going to stay core to, but recognizing the environment that we're coming in, what are the other issues that have come up in our space and beyond, right? And we'll talk a little bit about the actual meeting itself in a bit. Next slide. Yeah, so in addition to a new White House, we of course have new Congress, meaning a lot of new members sitting on committees of jurisdiction that oversee healthcare. General congressional dynamics, we are currently in what's called a trifecta government, meaning the White House, House, and Senate are all controlled by the same party, in this case, the Republican Party. What we have seen in just these couple months is an enormous level of unity within the Republican Party, something that's quite different than we saw even the last cycle. Specifically, the House Republicans are seen as being more fragmented. They're just a whole more number of members to come together and build consensus, but rather what we've seen is a lot of cohesion. And what I think a lot of people see is a very top-down approach where President Trump is really able to wield his power, getting a lot of the caucus in line and being able to advance a lot of his priorities that, frankly, a lot of people could not have imagined would have been able to move so smoothly through, given the dynamics of Congress typically, historically. And this has been very different that we've seen this go around. That's congressional cycle. Also, part of Congress that has taken a lot of Senate time is Senate nomination hearings and confirmations, meaning there are basically, for simplistic sake, the 15 cabinet members in President Trump's cabinet needs to be confirmed by the Senate. They first do a hearing, then they have to do a vote to advance that nominee out of committee, and then ultimately vote on the Senate floor. That has taken, all 15 have advanced, and that has taken a good number of days, at least, and a lot of attention on the Senate side. Next slide. After RFK Jr., there's, of course, CMS, FDA, NIH, CDC. I'm sure many of you know CMS, FDA, NIH nominees have been advanced and they've assumed their roles. CDC Director Susan Monarez was not the original nominee. It was former Congressman Weldon. His nomination was pulled right before his hearing. And so we're anticipating Susan's nomination hearing to be coming up at some point. Just for a timing perspective, next week and the following week, Congress is in recess, meaning they're not in Washington, D.C. There won't be, I say that meaning that her nomination hearing will not be happening in the next 2 weeks, but could be actually happening right before you guys come into town on May 1st. So could be confirmed by then. They've been actually moving through these nominations fairly quickly once they get their ducks in the row. Next slide. Okay, budget reconciliation. This is probably a word you've heard of maybe in the news, or budget reconciliation, budget resolution. I'll make it very simple. As I said, there's a trifecta government. There are certain tools or levers that a trifecta government is able to pull and be able to advance legislation pretty easily. And you can do that with what's called budget reconciliation, which only requires a simple majority to advance. That what's called a fast track tool, can only be applied to certain types of spending cuts or tax changes. It is a way to not, in this case, because the Republicans have majority in all three, to have Dem support. So if the Republicans actually caucus together in all chambers, which surely seems like they will, and there's no inclination at this point that they won't, that they will be able to actually advance a lot of Trump's tax cuts that he actually did in 2017 that are up for expiration, be able to extend those, do some of his immigration, energy, and border policy through the reconciliation process. And so that is something that will take a whole host of energy, already started this week. For situational awareness today, there's the first step for budget reconciliation is both chambers have to agree to what's called a budget resolution. That was ultimately passed. Senate had already voted on it. The House was left to vote. They advanced it and passed it out today. So that means that when they come back in 2 weeks, they're going to be working on what's called the instructions to the budget reconciliation, how to actually make a lot of those policy agendas from the administration come through. Not surprising, the other two items are on, we're seeing a lot of cuts. Yes, of course, I'm sure many of you track the Department of Government Efficiency, or DOGE, that is led by Elon Musk. Some of you may be aware, about a week or two ago, we're anticipating Musk to be moving out of DOGE, or at least not be considered a special employee, which he has right now, and probably return a little bit outside of the public sphere. It's most likely we'll continue to see a lot of efficiencies and a lot of cuts. But there's quite a bit that's already been done. And so I think there's a question of some political liability with having Musk continue on some of these efforts. And rather, there's been already a lot of cuts. How much more can really be done, and the need for him. Next slide. We provide a lot of this context to really bring it back to what do you all need to know on May 1st? And I'll kind of walk through each one. Not surprisingly, the tone and tenor around Washington, D.C. is no surprise. It's highly partisan. I would say it's been highly partisan for quite some time, but it surely feels like it's getting a bit more. And so what that means is IDF has worked across the aisle for all its years. The issues that you're bringing should be bipartisan. You're coming with your own personal stories. And that is something that no one can refute when you do a lot of I statements in your meetings. That is probably the best way to make your story feel compelling, and for the staffer to understand where you're coming from. I will note two of the issue areas that we're bringing up: vaccines, which unfortunately is no longer a neutral topic. It has become politicized. So instead of focusing on, the science, it's probably most effective for your meetings to center your message on your own personal story, including the risks to you or your family members when immunization rates drop. And we can you can think through some of the examples you can bring up in your own. How we'll think about this is when you mock yourself, how do you actually bullet out what you want to say for each of your asks? The other one is federal funding is not a neutral issue either. It's more of a philosophical one. I would say stick to the cuts that impact your life specifically in the federal government. So the clinical trials, the benefits you've had from the therapies, healthcare coverage, those are issues that you can speak to. Don't feel like you have to take all the issues under your breath. Speak to specifically how these issue areas impact your life. And as I said, the good news is we have a fantastic track record of achieving bipartisan legislative wins. As I mentioned, and Lynn mentioned, we have a SNF bill that we've advocated before. We've always had bipartisan support, always a Republican and a Democrat leading the charge on our bills. So definitely that tone is not changing, nor is that goal either. Next slide. A few more thoughts. Yeah, don't get too super discouraged by all of what I just said, actually. I know there are challenges, but they're not challenges that you have to worry about. Stay focused on your story. Keep it simple. You don't have to go into all the deep and weeds, but try to explain it to a third grader or fourth grader. What do you want them to take away from? Because a lot of these staffers are going from back-to-back meetings. And so you want them to remember your story or specifically your statistic, whatever it may be that you want to share. Try to keep it really simple and practice that point. And also, if you get any questions that you feel like this is super out of my wheelhouse, it is always okay to defer those questions elsewhere and to bring it back to IDF as well. Next slide. So what to expect in a Hill meeting. You're going to go into a Hill meeting with a number of the other advocates that are in your group. Next slide. And it might be, I put some pictures here on the left as to kind of how a meeting can be. You could either be in a room, you could be on couches, you could be in a hallway. It really just depends on space for that office specifically. Senate offices tend to be a little bit bigger, House offices tend to be a little smaller, but that rule doesn't necessarily always hold true all the way. In an effort to stay focused, you have 30 minutes with this office, each office that you meet with. You've traveled from so far. You want to make the most out of your time. This is probably the best, I would say, like formula or agenda to keep in all of your minds. You're going to do your introduction. I know that seems obvious. Everyone will go around and we'll talk about intros in a second, what that actually entails. And then break up each of the issues that Lynn noted. Priority one. So whatever priority one you as a group want to make that one, make that your first. Have someone who is like on deck to do the background, 3, 4, 5 sentences, what the issue is, why it's important. Have someone in your group who does the personal touch, why this is important to me, and then give it back to the staffer. Okay, you heard the background, you heard a story about it from a constituent. Do you have any questions? And then if you hear none, if you feel like you want to explain more, you can continue and then move on to priority 2. Do the same thing. Someone does a background, someone has a connection, a story, give a pause, and then go to 3 and do the same thing. It seems very rudimentary for me to say it like that, but the reason we say that is to break up the content and make sure that this becomes a conversation and you feel like the staffer has the opportunity to ask you questions because you are making the time to meet them. And also you can, you don't want to have to do a follow-up later if you can just answer the question right there and then, and it breaks up the content a little bit. So it's not a lot of like presentation style. It ultimately is something that you want to build a connection with that staffer. Next slide. So your elevator pitch, this is part of that intro when you're going around, and this after like your second or third meeting of the day, it'll become natural. It becomes almost like a pattern. You'll have your elevator pitch, hi, my name is so-and-so, I live here. Keep that to about 30 seconds per person. Don't go super long unless you feel like you have some deep connection with that office specifically. Let's go to the next slide. Maybe they'll give us a little bit more color. So I know it seems very obvious, but hi, your name is so, thank you for meeting with us. That's always nice to recognize that the staff are taking out time to meet with you. Of course, you're the constituent. And then I live in this place, I live in this city and state. I live with, and you can insert your condition, which is a type of primary immune deficiency, and then explain what that means, what your condition means. What does it mean for your immune system in simple ways? I'm sure you guys do this day in and day out. This is not so difficult. And then you can continue on like living with PI means this to me, and then move on to the next person in your group and keep that theme. So that way it keeps it structured, but also it allows each person to at least speak a bit about their condition, and also to give the staffer adequate like visibility of the span of conditions that fall under PI. That's also part of the intro to be able to talk about your condition. Next slide. I think this is keep clicking. For each issue, I put some just general thoughts, and I really this is not meant to be prescriptive in any way, but just to spin some gears here. When you have your issue on protecting vaccines, as I said, really focus on me, like a lot of me statements. My increased infection risk as someone with PI if there's no vaccines. How to actually bring in the measles outbreak that's currently ongoing and worsening in certain parts of the country. Make it very personal. How others not are being vaccinated impacts you. Why you rely on herd immunity to stay safe. How vaccine hesitancy impacts your daily life. Like bring all the buzzwords that people associate with vaccines, but then talk about yourself. What do you feel? Because no one can really refute your own, how you feel about this. This is your day-to-day life. Same goes for issue 2, safeguarding Medicaid coverage. Why is Medicaid important for the PI community? The IDF team is going to be sharing talking points for each of these issue areas, so you can just kind of pull and plug. And protecting research, as Lynn mentioned, some examples, but if you've been in a clinical trial, if you've gotten treatment, if you have done a diagnostic or screening test, a lot of that innovation was spurred by federal support. And so reminding staff of that is really important. And recognizing private funding, sure, can maybe fill in some of the gaps, but surely is not what we can rely on for especially rare diseases. Next slide. And the discussion, you'll have a discussion back and forth with the office. Hopefully allow them to ask questions, ask if the boss has any other healthcare priorities. Sometimes you'll be surprised. They might share a few items that might ring a bell to you, that those are really important. And when you go into these offices, you'll have a span of expertise. You might go in and the staffer is pretty junior. You can go into office and the staffer is super up to speed. I know some previous advocates have met other staffers who themselves or know somebody who has had a PI condition, and you'll be really surprised how many personal connections you can make with staffers when you're up there. Next slide. I know we just slippery. Okay. General advice. A lot of this is probably really obvious. be appreciative of the member or the staffer's time. A lot of them are going back-to-back meetings the whole day, 30-minute increments with different groups. So it's good to appreciate their time. Be concise, be mindful of the clock. I do think that practicing with your group and practicing just at home and even just the day before at the reception will be really helpful. Be friendly, be positive. Definitely do not be political. As I said, it's a very hyper partisan environment right now. So just stick to exactly what you want to talk about and your story. And then we can follow that IDF. And then, of course, recognizing that like is a daily, very repetitive kind of engagement you have to do with the office. So it's definitely surely not a one and done item. Next slide. Hopefully connection okay.
So I think, is this
I think
where we're
I'm
gonna
meeting time. So I wanted to,
Oh,
yes.
your
So this
sound
is the mock meeting time.
I think we're losing you a little, Nisha.
I apologize. Can you hear me now?
Yes.
I apologize. Hopefully you can hear me now. Yes, this is the time that you'll be broken up into groups. And I know IDF is going to do all the magic, but just some reminders that are on the actual slide. Intro, your elevator pitch, just try to be brief, be punchy, be compelling. The issue areas, make sure you connect it to your story. Each of you bring a very unique perspective. Bring that perspective to these offices. Bring that passion. And I would definitely say delegate certain topics to different folks in the room. So each of you get a chance to talk, but also be able to get through all the content effectively. And then when you go in the mock meeting, just talk it out with each other. If issue 1 and 2 is really important to the group, then focus on that, and you can talk about 3 as well. So I'm gonna hand it over to the IDF team.
Yeah, thank you, Nisha. So yeah, we will take a few minutes now. We're going to send everyone into some small breakout rooms, and it's just going to be an opportunity to kind of practice your pitch or kind of talk about, how you might want to frame your story for Advocacy Day. And just as a reminder, we'll talk about this a little bit later. You will have time before Advocacy Day at the reception. So this is kind of just dipping your toes in and thinking a little bit about your story and your elevator pitch, like Nisha said. So Emma, I think if we're ready, we can send everyone to the breakout rooms. I think we have everyone back. So I know that was very short, but just kind of wanted to give everyone a chance to be in a group and kind of just brainstorm for a few minutes about what you're thinking about for Advocacy Day, how you want to frame your elevator pitch, so to speak. And if you didn't have a chance to get to, in depth with practicing, do want to remind everyone that at the welcome reception on the evening of the 30th, you will have extended time with your group that you'll be attending meetings with to kind of work through that together, plan for your meetings, practice, all of that kind of stuff. So just want to mention that you'll have plenty of time before Advocacy Day to still work on that and kind of craft your elevator pitch and how you want to approach these meetings. So with that,
just jump in for a quick second and just say that I think it was a good opportunity to start the conversation, introduce yourself, whatever you were able to do. If you also can kind of practice on your own, think about the issues that we're trying to talk about today or on the first, and how, as Nisha was saying, how your story, which is unique, can support the asks.
Absolutely, Lynn. No need to apologize. That's a great point. Yeah, a lot of times Advocates for either Advocacy Day or other events will spend some time at home, with a friend or a loved one, just kind of practicing their pitch on their own, which is always a good idea. And then when you come to Advocacy Day, you kind of have something ready to practice with your group mates and whatnot. So that's a great point, Lynn. But yeah, so last but not least, we wanted to talk about some Advocacy Day logistics with you all as well. And a lot of this information should seem familiar. We have been sending out some emails over the past several weeks, and we will continue to send information leading up to Advocacy Day. But just kind of wanted to highlight some of the really important information that we want to make sure everyone knows about as we get closer to the event. So the first thing is just going over the agenda one more time with everyone. So Advocacy Day is going to kick off the evening of April 30th, that Wednesday. So at 5 p.m., that's when registration and the welcome reception will begin. We'll have some refreshments and heavy hors d'oeuvres served during that time. And then we will kick it off around 6 p.m. with some introductions. And then essentially we're going to use that time to review a lot of the information that we've gone through tonight as kind of a final refresher before Advocacy Day. So we'll review the Advocacy Day asks that Lynn discussed earlier. We'll go over some final logistics information. And then as we mentioned, you'll have some extended time to sit with your actual groups that you'll be attending meetings with and have some time to role play and practice and really just strategize for your meetings that are going to be taking place the following day. And then we'll wrap up that evening around 7 after we answer any questions or, final concerns that people might have, so that you're all feeling confident and ready to advocate the next day. And then we start bright and early on May 1st at 7 a.m. That's when breakfast will begin. And then after some kind of final announcements and reminders, we're going to depart for the Capitol from the hotel at around 8 in the morning. After a quick group photo in front of the Capitol, which is always a fun tradition, everyone will break off into their meeting groups and we'll start those appointments with members of Congress at 9:30. And then as you can see, we're going to wrap up at 4 p.m. that afternoon, giving everyone time to get back to the hotel or, get to the airport and whatnot so everyone can start making their way home. So if you have any questions about the agenda, feel free to reach out. Happy to clarify anything for anyone. And then especially for our young advocates who are taking part in the program during the day on Wednesday, wanted to also just review quickly with you all. So that program is going to start at 10:30 on Wednesday. We'll do some quick introductions and kind of go over why it's so important to have you all in the conversation and advocating, on behalf of young members of the community. And then we'll do a quick lunch. And then in the afternoon, we'll head out to kind of the National Mall area, do a fun field trip. And then get back around 4 so that everyone has a little bit of downtime before the reception that evening. So that's kind of what you guys are looking at for the program during the day on Wednesday. And then wanted to highlight some general information. A lot of this has been shared previously, but just wanted to highlight this, and we'll continue to share information as we get closer. So as you all should know by now, registration for Advocacy Day does include the one-night hotel accommodations at the Royal Sonesta. So that is already taken care of you by IDF. It's covered and arranged for you ahead of time. And that's going to be for the night of April 30th. And then for the young advocates who are taking part in the program during the day, you also remember have accommodations for the evening of the 29th as well. And in that same vein, everyone who is staying over, at the hotel for Advocacy Day, you will receive a confirmation via email prior to Advocacy Day, just to verify your accommodations and make sure we have all the information correct and that we need so that when you arrive in DC, everything's ready and arranged for you. Also, speaking of travel, participants are responsible for arranging their own transportation to and from either the airport or the train station. We have shared information, detailed about the metro and taxis previously, but if you have any questions, feel free to reach out to us. Happy to help you get that organized. And then something that's a little different this year that we wanted to highlight is that each registered participant of Advocacy Day and Young Advocates Academy is going to receive a standardized per diem reimbursement for the days that you participate in the event. And essentially, this reimbursement is meant to cover any of the additional costs that you incur participating in the event. So transportation, if you buy meals, anything like that, that's what this reimbursement is meant to cover. So just a little heads up that that's something we're doing a little different this year, but you'll still be getting that reimbursement after you participate. And then also meals, of course, this is important to everybody. On Wednesday, like I said, the reception, we will have some refreshments and hors d'oeuvres during that time. Thursday morning, we'll have breakfast, and then lunch, we're going to leave up to the discretion of all of you. So you'll be in groups, obviously, for your meetings, and you will have time blocked off around lunchtime where you won't have any meetings. So totally kind of leave that up to you guys as to where you'd like to get lunch and when you'd like to get lunch. There's a lot of cafes and canteens around the office buildings there. So plenty of options for lunch. So leave that kind of up to you guys. Also luggage, we get a lot of questions about this. It can be held at the hotel during the day on Advocacy Day. And then if you want to go back after your meetings are concluded and grab that before you head out, that's perfectly fine to do that. As Anisha mentioned, there is a bit of walking to and from offices during the day, so always recommend people bring comfortable shoes. You do have to walk, between offices or sometimes office buildings back and forth. So just make sure you're having those comfortable shoes to wear during Advocacy Day. And then professional attire is recommended, but we definitely encourage zebra stripes if you have any. So if you have a zebra blouse or pants or a suit jacket or anything like that, really encourage you to wear that and kind of represent the PI community as a group on Capitol Hill with our zebra stripes. And then just kind of wanted to zero in on congressional meetings. So this is kind of some information that we wanted you guys to have ahead of time. And if you have any questions, please reach out to us. But for your congressional meetings, if you have not done Advocacy Day with us before, your group will consist of anywhere from 3 to 6 participants. And these groups are going to contain individuals from either the same state or neighboring states. Each group will have 3 to 6 meetings during the day on Thursday. And then all of your meetings will be in the Advocacy Day app, which we'll talk about briefly in the next slide. Again, during the welcome reception, your group will have time to meet and kind of plan for your meetings the following day. And then one reminder is just to allow time to get through security at those congressional office buildings. Sometimes during the spring, it can get a little busy. So just make sure you're leaving a little bit of buffer time between meetings. And then lastly, this is just kind of a coming attraction. We didn't want to overload you guys with too much information tonight. So the Advocacy Day app is going to be kind of your hub or home base for Advocacy Day. It's going to have all the information on your meetings, talking points, handouts, pretty much everything you're going to need during the day is going to be in this app. So next week, you'll actually receive information about how to download this app. And we will be sharing a short training video that walks you through the app if you haven't used it before. So that's information is going to be sent next week, but just wanted to give you all a heads up that that's going to be coming soon and just to keep an eye out for that. And if you have any issues downloading it or have any questions about how to use it, our team is absolutely here to help and walk you through anything we need to. And I think with that, Stephanie, I know we had some Q&A throughout, so I'm not sure if there's any remaining questions, or if you haven't asked a question yet, please feel free to pop it in the Q&A, and our team is happy to answer any questions you might have.
I don't know if this is a question for Lynn or Fagri. I have one question that I certainly cannot answer. It says, who is helping reform methods for reorganizing?
Is that, I mean, that may be pertaining to the reorganization of the Department of HHS that's been proposed. So there's a lot of reorganizing that's been
Yes.
in the mix or proposed or tentative. So that's if that's what it's pertaining to, then that would be coming from HHS. There are obviously a lot of questions still swirling, as many of you know. Last week they proposed a fairly significant reorganization of many HHS agencies, including the CDC and the FDA, and also the department more broadly. Congress has a lot of questions. I think there's actually a congressional staff briefing tomorrow afternoon on this, and they're hoping there's interest in getting Secretary Kennedy before some committees fairly soon, potentially even during the week that we're in town. So I think there's a lot more coming on this in terms of explicitly what that looks like and all the many details. So if that's the question, I think a lot more will be coming, and I think it's something that IDF is going to continue to pay close attention to, particularly in the areas and on the programs that are most important to us. I don't know, Lynn, if you have more you want to stir in, or Nisha, but that was my thought.
Yeah. No, I mean, I think that there's a lot that we don't know, and I've what we're hearing like from other patient groups that even legislators are asking patient groups like who do we talk to? There's just a lot of uh, there's so much change happening that a lot of it's kind of we'll be learning it as we move along, and we'll probably know a little bit more by the time we hit Advocacy Day in a couple of weeks. But our messaging is going to stay the same, and we're our job while we're there on May 1st is communicating with legislators. So and they will be communicating with the agency. So when we have issues with, like we're concerned about vaccines and where it isn't per se a legislative ask, but sort of an education, but it's also letting them know that this is a priority of ours and we want we may want their engagement with the executive branch, with the agencies, when on particular issues. I think there's a lot of concern about the measles outbreaks and things that, so there could be legislative initiatives down the line or actions or letters. So just sharing our priorities around the agencies is important. And with funding for NIH and other agencies, that the legislators do have a role in that, and that's why it's important for us to share about funding for these agencies. So even though we don't know exactly what's happening with the reorganization, we do know we know what is important to us and what functions we need to have to protect our community, and we can always be sharing that message. And I just wanted to point out, I saw one of the questions, this breakout rooms that we just did, those are not, those were just random groups. You're going to be with your state, we're still working out, exactly which groups you're going to be with, but you'll meet people when you're or right before in the app for the for Advocacy Day, but that was just a way to do some practicing.
Becca, one of our questions is regarding transportation to and from the hotel to Capitol Hill. Do you want to briefly discuss that?
Yeah, absolutely. So the hotel is kind of right down the street from Capitol Hill. So those that are able, we will kind of head to Capitol Hill walking as kind of a big group. And then we will, if anyone has mobility issues or is not able to walk to Capitol Hill with the group, we will have alternative transportation. It is limited, to a certain number of people. But we will be sending information about that in the coming weeks, and there will be kind of a sign-up process for that. So we certainly will have options for everyone to get to Capitol Hill.
We don't have
Another
specific bills right
thing.
now. Sorry. I know I'm just jumping in, but someone asked about whether there's specific bills. We don't have specific bills right now besides well, even that has to be reintroduced. So we don't have specific bills, but so we're just basically kind of messaging. But like the issue of Medicaid cuts is a real issue that's being considered part of the reconciliation, right? And so there's legislative action that will be taken on particularly on the Medicaid issue, but there's not a bill number. Or,
People are certainly welcome to wear masks. They don't need to feel that that's something they can't do if they feel comfortable wearing a mask.
yeah. And it with in terms of state-specific issues, we will have for Medicaid, we're going to have a fact sheet that's state-specific and it has some stats regarding how that your particular state will be affected, and each group leader that regarding that will have the fact sheets on those states. So that's the only one that's state-specific. But the issues are broad, and I think the messages are all broad and federal based.
This question is, should an individual talk about Medicare cuts that they've heard about, or do we want individuals to stick to the talking points that we have outlined for them?
We want you to stick to the talking points that we've outlined for you. There's a lot of potential issues down the road, but what's kind of at the forefront right now is the Medicaid cuts. I think, a lot of people, even if you are not on Medicaid, I think you can share if you rely on, health coverage, whether it's Medicare or private insurance, you can relate to how if somebody who relies on Medicaid does not have that coverage, how that would impact them. So, and there's also a lot of people that are dual eligible, so they get Medicare and Medicaid. But speculation about Medicare cuts is not on our agenda. In terms of,
Go ahead, Lynn. I'm sorry.
I was just going to say, and Becca can jump in and help me with this. In terms of group leaders, we're going to have some of our IDF staff will be distributed throughout, so they will definitely be group leaders. And then we have some volunteers that have been part of our long-term volunteers. Either they were part of the Health Access Advocate program, or they've come for several years and are very experienced. So you'll be, if you're in that group, we'll be reaching out to you. You'll know ahead of time, and you should be in, and if you're not, you're going to have someone either who's an IDF staff or a very seasoned volunteer, or potentially a FAGRI staff person. But you'll have somebody that's experienced to lead your group.
Absolutely.
And Becca, we have a question about what the youth advocates should wear for the Youth Advocates Academy Day.
Oh yeah, that's a great question. We tend to keep it pretty casual, so jeans are fine. We will do a little bit of walking on the field trip. So maybe just some comfy shoes, but otherwise, casual is a-okay.
So you're always welcome to have IDF swag if you have a
Oh
t-shirt
yeah, we
that
will
says
be having
IDF
our
from a walk
IDF
or
swag.
something.
The IDF
Or a
staff will.
zebra shirt or something. That's always welcome.
Stephanie, I think we have time for maybe one or two more questions if there's any kind of lingering questions that people posed.
We had people wondering when they would find out who their group leaders were.
Yep, that's a great question. So that'll be early next week. Like Lynn said, that will be either seasoned advocates who have, done advocacy with us before, or that may be an IDF staff person. So yep, you will find out early next week, and then we will be doing a little separate short call with you all to make sure that you're ready and feel prepared to lead your groups for Advocacy Day.
Finally, what's the appropriate dress for the reception attire?
I mean, it'll definitely be a mix. I would say, something that is presentable. I know some people are traveling, but just jeans is fine. Some people might be wearing more business wear, so that's fine. It's really, no certain dress code per se for that.
Yeah, if you want to dress up, if you like to, get in a dress,
feel
and look
free,
nice.
but don't worry about it.
But it's not like
traveling.
if you're not dressed in, your ball gown, you won't be allowed in. But it'll be probably either, business casual, on the professional side, or if if you want to be more casual, or, just kind of, how you would be going out to dinner in a restaurant that's not super fancy, but but it's really, we're not, whatever you want to wear is fine.
Okay, and there were individuals I said that you would be receiving a direct response from us. There were just some things that we had to look into, so you can expect that. And I think that we're all set with questions.
Perfect. Well, thank you all so much for joining us. We're really, really excited to have you all in DC in a few short weeks. And just as a reminder, this has been recorded tonight, and we will be sending it out, early next week. So if you, want to rewatch anything or refresh your memory, you'll be receiving that. And then, of course, if you think of any other questions in the meantime, please feel free to reach out to us. You guys can see on the screen there our team inbox is idfadvocacy@primaryimmune.org. So please, don't hesitate to reach out to us in the meantime.
Great.
Take care.
Thanks all. See you
Bye-bye.
soon.